Hello! We are back on our weekly live. Where are you guys? Come on. Where are you? Who's there? Hi, Letícia. Olá. Você é a primeira. Hoje vai ser em inglês. Vou responder algumas perguntas dos meus clientes aqui no Egito. Fizeram-me algumas questões, querem respostas. Mas hoje à tarde é com o professor Rodrigo. Deixe-te lá. Oi. Guys, I'm waiting for you. I'm going to answer your questions. Some of you sent me a few questions, so I will answer them. People ask me about the way to see if your anatomy is good or not. So we're going to talk about anatomy, how to know if you can have a piercing or not, and we're going to talk about what to expect during the healing. So yeah, it's pretty good things to talk about. So I'm just sending this live to a few of my clients, a few of my friends. I'm going to give you like 1 or 2 minutes just to do this, to do the same. Please send the airplane on those who need to learn a bit about anatomy. You can even send me pictures, or if you want to get live with me, so you can show me your anatomy and see if you can have a piercing or not. Please be my guest. Just request to be part of this live. It's going to be interesting to have you like that. Okay? Yeah, I sent to a few. Today is going to be in English. Sorry, this live. But this night I'm going to have a live with a Brazilian professor. He's a specialist and selling stuff on Instagram, so it's going to be in Portuguese. If you don't understand Portuguese, it's not going to be interesting for you. But if you do, please watch it. It's going to be awesome. So guys, I have a question. The first question you guys sent me, let me just recheck so I don't miss it. I want to answer your questions. Hi Hannah, come on, join us. Boo boo boo. Let me just see if I can open this. Open the questions. Yes. Whoop. So I have a question. La 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 la. Da da da. You can write other questions if you want, guys, so I can answer. So about anatomy, I know. Well, when you go to a place, sometimes you have an idea of getting a piercing, but then you don't have the proper anatomy. Yeah. So the person you go to has to be professional enough to tell you no, if it's not possible to do that piercing. Okay. So how come there are some places you can't have? Oh, my friend has a piercing, but I can't have it. Why? So guys, what you must have in mind is that all depends on your anatomy. Okay. For example, if you want an industrial, look at my ear. I'm going to show you my ear. Okay. Oh my God. So look at my ear. Okay, I can't see what I'm doing now, so I hope I'm showing the right thing. So if I want to have an industrial, you know, that piercing that goes from the front to the back, I couldn't have one. Can you tell me why? I have this flap here, yeah, that it's good enough to have a jewelry, yes, but then I don't have it here. So if a piercer wants to put a piece of jewelry on you, an industrial bar, using this and then doing this to pierce you, is not doing right, because look at what happened. If I have something here and here, our skin is like it's kind of soft, yes. So if something is pressing, imagine that the skin will, first of all, will reject. Okay, so any strange object in your body, the body will try to reject. Okay, to migrate. So if the industrial bar is okay here, but then it doesn't have space here, my ear, the skin is going to force until the bar is completely out. So it doesn't matter if the piercer wants to pierce you or if you want to do it. If your anatomy doesn't allow, it's not safe. The same way, imagine you see this here, it's a bit higher than my helix. Okay, so if I had an industrial bar coming from here to here, it would touch this thing here, the flat, okay? With time, that bar was going to cut my skin and get inside, okay? So I couldn't have an industrial bar, okay? So even if I want, if oh, it's nice, blah blah blah, I don't have the proper anatomy to have it. So when you go to a piercer shop, that person must always, the first thing that person have to do is to look at your anatomy. I had people coming to my studio that I said, sorry, I can't do your industrial. Sorry, I can't do your tragus. Sorry, I can't do your belly button. Okay, so there are a few nice blah blah blah. yeah. So there are a few places, like imagine the nose. Oh, I had one person. I think I told you about this story. The nose, the nostril, you think, no, it's everyone can have it. Yeah. So, but there was one person I said no, and I already told you this story on a previous live. It was May Ezeldin, yeah, the famous actress. She came to me and she had a nose piercing, a nostril, but she had then a plastic surgery, so she had her nose done. So the place where the stitches were was exactly the place where the hole must be done. So I told her, okay. I told her that I couldn't do it. She wanted desperately, she wanted to have it, blah blah blah. I even told her to talk with her doctor, and he was saying, no, you can do it if it's a little bit higher, blah blah blah. But a little bit higher was not safe, was not the right place to have it. So we decided not to do it. And guys, it was very nice for me to have on my portfolio a piercing on May Ezeldin, yeah? But I had to be honest and I said, no, it's not safe for you. Okay? So, how can you, a client, see if it's proper or not to, if your anatomy is okay to have it? If there's enough skin to place the jewelry. Okay, what do I mean by enough skin? Like I told you, if you apply a piercing, your body is going to try and reject it, migrate, expel the jewelry, okay? Because for your body, that piece of jewelry is a strange object, okay? And it's not safe, and especially if it's not a safe and biocompatible metal, your body is going to try and expel it as fast as possible. So you have to check if, like, imagine, I'm going to draw something here that is probably easier. If you have, like, imagine here the helix, okay? The jewelry must be placed in the center of the helix, okay? So if I have a very thin helix that cannot hold the jewelry and have enough space to the sides, I cannot do it. Like here, my helix is very short. So I can have a piercing going here and up, but then here my helix starts to be very thin. So it's not safe for me to have a helix here. I can have, if it goes from the front to the back, yes, because it goes through and it has enough skin. But if it is too at the edge, it's going to be easier to expel, okay? Your belly button. Some of you have what is called a sad belly button. That is something that looks like this. It makes a sad face, okay? So if your belly button is like this, sometimes it's harder to have that little ball, that jewelry at the end, at the bottom. So for example, the sad belly button, it's easier and it's safer to have like a flat jewelry here that it doesn't, you can't see it, and then a piece of jewelry coming out just from the top, okay? Yes, a lot of you don't want this option because you want the jewelry coming out of your belly button, but sometimes it's not safe, so it's better not to have it, or have a different option, okay? You cannot have an industrial, so have a forward helix, or for example, I have some jewelry that I can adapt. For example, I can have a piece coming out here and then going here and coming out from the back. So that kind of industrial, yes, it's possible to be done. I'm giving an industrial example because this is, I think, the most common piercing that the anatomy doesn't allow. Or maybe the nipples. If you're a man, sometimes your nipple is very small and it doesn't have enough skin to grab the jewelry and keep it there. Sometimes women have flat nipples or inverted nipples. It's possible? Yes, it's possible, but it's a different technique and not every person, every piercer knows how to do it, okay? Other places, the example I gave you, the nose, if you have any, the septum. Sometimes you have, I don't know how to say it in English, when your septum is not straight, sometimes it's not possible to have a septum piercing, okay? Piercings that are not safe to be done. For example, the snake eyes, though now it's fashion, from here to here, okay, and it's a bar that crosses your tongue from one side to another, like this. Your tongue, it's a muscle, and it's a very strong muscle, and that's why people split their tongue and they can move the tongue like this, okay, like this, because there are two different independent muscles. So imagine that you have two muscles that can be independent and give you all the movements your tongue needs, and then you put a bar crossing and blocking those muscles. It's very dangerous. It can cause you a lot of issues, can damage your teeth. It can also damage your gums, and it can create problems on your speech and blah blah blah, more and more and more. Okay, the same as these, the cheek piercings, they are not safe, okay, because around here on our face we have some very important vessels, veins, and some muscles and tendons, and if they get affected and you don't know where they are, every person is different, so you don't know where they are. So if you pierce and you get one of these, you can have serious problems, okay? So be very careful. So more. I don't know if you ever heard about it, but here it's called the triangle of death, okay? So all this area here, it's dangerous. So we have to be very careful when we get the piercing on this area, okay? There are a lot of important vessels that are around our face. So, about anatomy, this is it. My recommendation is always go to a piercer shop that you trust the person you are piercing with, and you know that person knows about anatomy, so he can check your anatomy, okay? That's why my clients know when you get a piercing on your ear, I always check with the light, so I can I can see where the main vessels are and try to avoid them. Aline, você não percebe inglês, não é? Estamos a falar de anatomia, como perceber se temos uma anatomia que dê para pôr um piercing ou não. Perguntas que me fizeram. So, always trust your piercer. Make sure you go to a person that is certified and knows what he's doing, okay? We must study about anatomy, okay? The other questions I received was what to expect during the healing. Okay, guys? So what to expect when you pierce the first couple of days, it's pretty normal to have some swelling, to feel some heat, to have your ears like a bit red like mine is now, because I've been touching and moving my ear. So imagine with an open wound there. So any piercing will... Nem 1% de inglês. Hoje à noite vai ser em português com o professor Rodrigo. Às 4 da tarde aí. Não percas. So your body is going to, once there's an open wound, your body is going to send a lot of it's like a war, you know, where the battalion goes and try to fight. Okay, so our body sends a lot of fighters to fight against that wound and the bacteria and everything that can come inside our body through that wound. Okay, so all that creates like a heat on the piercing place, and redness and swelling. It's important to happen. So it's pretty normal when you pierce for a couple of days, like 3 to 5 days, that you feel that heat, that swelling, that redness. So it's pretty normal. Don't freak out. After those 3 to 5 days, the swelling is going to reduce. It's not going to hurt that much, And most of the time, guys, it's when you stop cleaning your piercing, but you can't. Even if it's not hurting, it doesn't mean it's not healing, okay? Because especially the cartilage, because we don't have many vessels and we have a lot of different kind of tissues, they take a long time to heal. And when we say a healed piercing, means it's the skin around the jewelry, it's totally new and connected to the blood, the body, to the flesh, etc. And it's totally closed. The wound is totally closed. Okay, I already spoke about the anatomy, so go back and check. And I'm answering the other question now. If you have any questions, please just write it down and I'll answer. So, what to expect during the healing? The first couple of days, redness, heat, pain, but not severe pain, okay? You will remember, for example, if you have a ear piercing, you'll remember that you have an ear that it's usually we don't feel our ears, okay? So, after those days, the redness is going to disappear, the swelling is going to reduce, the heat is going to disappear, and we must keep on cleaning our piercing, okay? After 2 weeks, more or less, it's when we're going to see like a whitish discharge, okay? That discharge is pretty normal, okay? So don't freak out unless it's not whitish, okay? If it's whitish, it's okay, it's the lympha, so all the good fighters from our body that are going and acting on your wound to heal it, okay? So don't be afraid if you see a whitish discharge. If it's dark yellow, if it's brown, if it's gray, green, like that's not a good sign, okay? That's a sign of infection, and if you have an infection, you must go to a doctor straight away, okay? There's nothing your piercer can do if you have an infection. If you have a granuloma, like the bump, yes, your piercer can help you, but if you have an infection, you must go to a doctor, okay? So, after the swelling and the discharge, it's very important to keep on cleaning your piercing, because that discharge has good bacteria, but they also have not that good bacteria or bad bacteria, okay? Because it's our body that is expelling everything that is not good for it, for the wound. So it's trying to put it out. That will dry with the air, okay? So it's important that you clean it. When will you clean it? When you do the aftercare with the saline solution, okay? If you have like a little crust from that dried discharge, don't peel it, okay? Because sometimes that crust is attached to the new skin, and you pull it and you rip the new skin and you create a new wound, okay? So the safest way to remove those dry crusts is by softening them with the saline solution, okay? So clean it with the saline solution. If they come out, use a Q-tip gently. If they come out, perfect. If they don't pull it, okay? It's not safe. So after your piercing is fully healed, you can remove the jewelry you have. You can leave it without the jewelry. It's safe. The wound is not, the hole is not going to close, because a new skin is fully reestablished on that area, and the hole will be perfect. You can take the jewelry out, you can leave it for a couple of hours, couple of days with no jewelry, and the hole is not going to close. It might shrink, yes, it will shrink because it's our body, our skin has this elastic property, but it's not going to close easily. You can put a jewelry back in and it's not going to be an issue. Okay, if it's not fully healed, if there is a tiny little space that doesn't have that fully recovered skin, of course it's still a wound and your body is going to close the wound. Okay, so sometimes it happens especially on nose, okay, because we have the mucus inside. Sometimes we think that the piercing is fully healed and we remove the jewelry and right away inside it's blocked, it's closed. Okay, it happened to me with a client that came to me and said, oh, I have this piece of jewelry for around 2 years and I want to change it. Okay, so I thought, well, 2 years is... It seemed healed. Yes, it seemed healed. I removed the jewelry. It was these many seconds. I removed the jewelry, the old jewelry. I placed it on the station. I grabbed the new jewelry and I started inserting the new jewelry, and it was closed. These few seconds. I asked her, do you want me to force it, reopen the hole, blah blah blah, and she decided, no, I don't like the placement, so let it close and then I'll redo it again. Was her option, but after 2 years, if this happened, it was not healed completely, and it was not, most probably because the placement was not correct and it was not fully healed. Okay, so about anatomy we already spoke, what to expect during the healing. One thing that I want to remind you about the healing. If your piercing doesn't hurt anymore, it doesn't mean it's already healed. Okay, if a piercer says it's 4 months, around 4 months, it means it's around 4 months or even more. Depends on how your body heals and how you take care of it, and if it doesn't happen any granulomas, anything that like in the middle of that period of time. So keep on cleaning it. Our body has the capacity to clean it, not to clean it, to heal the wound by itself, but if we give an extra help, it's going to be easier on our body. And we know that we're not cleaning our wounds all the time. So we have the dust, we have the bacteria that live in the air and everything, all that. Our hands are the most dirty things because we touch everywhere. Now we are constantly, or we should constantly be disinfecting our hands, but even though if we touch our wounds with our hands not properly clean, we are putting bacteria on it. So all this will delay the healing. Okay, even if it doesn't hurt, don't stop cleaning your piercing. And if you have a ear piercing or a belly piercing, don't sleep on it. Okay, before you downsize the jewelry, don't sleep on it, because you're going to change the angle, and guys, after you change the angle, the healing is going to be more difficult, and sometimes it doesn't heal at all. And you, at the beginning, when you went out from the piercing shop, you had a perfectly straight, proper angled piercing, and then you slept on it and you change it, and then, oh my god, what happened? It was perfect. You changed the angle by sleeping on it, and it's not going to heal, and you have to take it off, let it heal, and do it again. So please be very careful. It's in your hands. In your hands. So, do you have any other questions, guys? Abdallah, Manal, Katya, English. Any other questions that you want me to answer today? If not, we can end our live. Nope. Okay. So guys, I'll see you next week. Friday at 4:30 in Egypt, 2:30 in Portugal. Oh, when are you coming to Egypt? Well, good news is here in Portugal, yesterday the Prime Minister announced that we are going to start reopening the country. So hopefully very soon we can travel. Yes, so I can arrange my trip back to Egypt. So let's see what happens. We're stuck in here for so long. I want to go back. So let's see. So, no other questions? Well, guys, I'm waiting. Yes, I want to go back as soon as possible. A lot of people every day, I have people asking, when are you coming back? Are you in Egypt? So, let's see. Okay? So, guys, see you next week. If you have any questions, just text me and I'll try to answer as much as I can. And if I have many questions that require an extra live, I'll do it. It's easier to answer maybe on a live than texting. Okay? See you next week. Bye.